Pressure my scene is safe to enter. There is no visible water spillages, obstacles and cable wires that may cause faults and trips. And I will draw the curtains to provide privacy and dignity to my patient. I will close the doors and windows. I will do my hand gel according to WHO standards before I approach my patient. Palm to palm, back of the hands, interlace, interlock, rotation motion of thumb, fingertips, and air dry for 30 seconds. So now I am happy to approach my patient. Hi Samantha, good morning. How are you doing today?
I'm good, but I'm having pain on my right hip.
It's okay, I'll do the needful things. Are you the mother of Samantha?
Yes.
How may I address you?
Heather.
Hi Heather, my name is Sophia Anthony. I am the Samantha's nurse for today. I am here to do some assessment, taking observations, and I may be asking you a couple of questions regarding your condition. Is that okay with you, Heather and Samantha?
Yes.
Okay, before I do anything, would you mind to tell me your full name and date of birth, Samantha, to me so that I can counter check with your ID band and in my record also. Is that all right?
Yep.
Okay.
My name is Samantha Rue. My date of birth is 1st of January 2008.
So I can see in your date of birth that your full name is Samantha Rue and your date of birth is 1/1/2008 and your MRN number is 1234567X. And I can see a red ID band in your hand. So Heather, can you tell me, is Samantha have any allergies?
Yes, she is allergic to latex and pollen.
Okay, and what will happen if she will come in contact with those two substances?
She gets rashes.
Okay, I can see the same on your ID band also. So I'll make sure that I am not using any latex or pollen substances so that she will be safe here. Is that all right?
Okay.
Okay, so as I mentioned earlier, I am going to do some assessment, taking observations, and I may be asking a couple of questions. Is that all right?
Okay.
So would you mind if I go wash my hands, wear PP and take the Dynamap and come back? Okay, I'll do my hand gel according to the WHO standards. Palm to palm, back of the hands, interlace, interlock, rotation motion of thumb, fingertips, and air dry for 30 seconds. Now I wear my PP. Heather, can you tell me why did you bring Samantha here today in this hospital?
So yesterday she had went to a slumber party in a friend's house and there she fell down. And then while she coming back she was fine, but then she was limping a little by her right feet. But then as she woke up in the morning, she was not able to move. She had bruises and there was swelling as well. And when I tried her to make her walk, she was not able to walk as well.
Okay, I'm so sorry to hear that. But after the assessment, I'll go through her prescription and I'll do the needful. Is that all right?
Okay.
So Samantha, may I ask you some questions?
Yes.
Are you going to school?
Yes, I am.
Which level are you studying?
Grade 6.
Grade 6. So who is your favorite teacher?
It's Audrey.
Okay, so now can you tell me where are you now?
Yeah, I'm at the hospital.
Okay, examiner, I can confirm that Samantha is alert and oriented. So Samantha, thank you for answering those questions. So as I mentioned earlier, I am going to do an A to E assessment, in that airway, breathing, circulation, disability and exposure. So I can explain each and every procedure during when I am doing. So the first thing, I am going to check your airway. Is that alright, Samantha and Heather?
Yes.
Okay, so for that, can you please open your mouth for me? Okay, I can see that the airway, there is no visual obstructions. Can you give me a good cough? Okay, so I can confirm that Samantha has no airway obstructions and the airway is patent. So now I am going to move to breathing. In that, a couple of things I am going to do. In that, the first thing is, I cannot hear any breathing noises like wheezing, rattles, coughing as well as a stridor, and I cannot see any respiratory distress like usage of respiratory accessory muscles, seesaw breathing, coughing and sweating. So Samantha, now I am going to check your air entry. For that, can you please sit on your back now?
Okay.
Thank you. So would you mind if I touch on your back?
Yes.
Okay.
Yes, you can.
So now I am going to ask you to inhale and exhale. Is that all right?
Yep.
Okay. Inhale, exhale, inhale, exhale. Thank you. That's perfect. So now you can sit perfectly. Thank you for that. So I can confirm that Samantha's air entry is equal. So now I am going to check your blood pressure, oxygen saturation and your pulse rate. Is that okay, Heather and Samantha?
Yes.
Okay, so so now I am going to put this blood pressure cup on your arm. So Samantha, do you have any preferences?
Can use my left arm.
Okay, I can. Can you please expose a little bit?
Okay.
Okay, so now I cannot see any infection, bruises and skin lesions. And Heather, can you please tell me, is she underwent any surgeries before in this hand?
No, she has not.
Thank you for confirming that. So I cannot see any cannulas, fistulas, infection and skin lesions. So I am happy to apply this blood pressure on this arm. So I am going to apply by using a 80% of your upper arm, and I leave 2 fingerprints. Is that all right?
Yes.
Okay. So during the time of measurement, you may feel little bit of tightness, but don't worry, it will go off soon. Is that all right?
Yeah.
Now I am going to check your blood oxygen saturation level by using this saturation probe. For that, can you lead me your another hand? Thank you. So before that, I am going to check your capillary refill time for 5 seconds. So I cannot see any nail varnishes, infection, inflammation and skin bleeding. So Samantha, I am going to press your fingertip for 5 seconds. Is that all right?
Yep.
Okay. 5, 4, 3, 2, 1. So it's less than 2 seconds. So I can confirm that Samantha is having normal capillary refill time. So Samantha, I am going to put this on your finger. Is that all right?
Yep.
Okay. Are you comfortable?
Yes.
I'll turn on the machine now. Okay, meanwhile, I am going to check your pulse rate for 2 minutes. The first whole minute I will check your pulse rate, and the second minute I am going to counter check. Is that all right?
Yep.
I will be silent for these 2 minutes, and I will appreciate you too if you can do the same for me. Is that all right? So Heather, can you move this side?
Sure.
So using my 4 buds, I am going to check your pulse rate. My 1 minute starts now. I am going to cross check your pulse rate for another 1 minute. So I am going to place my hand on your chest. Is that all right?
Yep.
Okay, so my 1 minute starts now. My 1 minute ends now. Your pulse rate is 72 beats per minute with its normal strength and rhythm, and your respiratory rate is 20 breaths per minute with its normal depth and rhythm. Sorry, I didn't inform you regarding the respiratory rate checking, Samantha and Heather, because the child is conscious, it may alter the values. That is the reason. Is that all right? And Samantha, your blood pressure is 139/92 mm of Hg, and your oxygen saturation level is 100% on room air. Okay, so I am going to remove this BP cuff. From infrared thermometer, I came to know your temperature is 38.5, and it is little bit high. I know that you are febrile. After this assessment, I will go through your prescription and I will do the needful. Is that all right, Heather and Samantha?
Yeah.
So I am going to complete the circulation. For that, I am going to check your palm. Okay, so for that, can you please show me your palm? Okay, your palm is pinkish in color. I am happy for that. The another way to check the pallor is to check your lower conjunctiva. For that, can you please touch your face?
Yes, you can.
Okay. So I will touch your face and lower the conjunctiva so I can see that it's normal. Now I am going to check your perfusion. So that can I touch your upper and lower limbs?
Yes.
Okay. Okay, it's warm to touch, so I can confirm that Samantha's perfusion is normal. Heather and Samantha, now I will move to the disability assessor. As I mentioned earlier, Samantha is conscious and alert. So now I will ask you regarding your pain. Samantha, are you in pain right now?
Yes.
Are you comfortable to continue the assessment now, or you can tolerate?
Yes.
Okay, that's great. So after I finish the assessment, I'll show you the pain phases so that you can tell me which level are in pain. Okay, is that all right, Heather and Samantha? Okay. Now, Heather, can I ask you some questions regarding her urinary output? Is that all right, or did you notice any changes or abnormalities?
No, she has a normal urine pattern.
Normal. Okay. Samantha, can you remember when did you last pass your urine?
I think it's earlier 10 a.m.
10 a.m. Oh, that's great. Then Samantha, is by any chance are you diabetic?
No, I'm not.
Okay, Heather, is that right?
Yes, lastly, she was checked, her blood glucose level was 4.2 millimoles per liter.
Okay, that's great. I am happy that it's within the normal range. Okay, so Samantha, are you going to school?
Yes.
Which school are you going?
King's Middle School.
Okay, so what is your favorite subject?
Math, medium subject.
Okay, do you have many friends at school?
Yes.
Okay, thank you for answering those questions. So I can confirm that Samantha is conscious and alert. So now I am going to check your eyes by using this torch. Is that alright?
Mm-hmm.
For that, will you able to close your eyes by using your hand?
Okay.
Okay, thank you for doing that. Okay. Thank you. So I can confirm that Samantha has normal pupillary reactions. It's 3 mm dilating, reacting to light. I'm going to check your movements for your upper limbs and lower limbs. Is that okay, Samantha? For that, can you please raise your both upper arms together? Okay, so now I will apply some pressure. Can you please try to resist? Okay, thank you. I can confirm that her upper limbs movements are normal. So Samantha, will you able to raise both of your lower limbs together?
Only my left.
Okay, so you have pain in your right. Okay, that's fine. So I will apply some pressure. Can you try to resist on your left? Okay, I can confirm that the normal movements in her left leg, but she has some pain on her right leg, so that she cannot move properly. For the GCS assessment, I can see that Samantha's eyes are spontaneously open. So it's E4, and for the verbal, she is oriented, conscious, and she is responding well for my question. So B5, and for the motor, she can move her upper and lower limbs. Because of pain, she cannot move her right limb. So it's V6. So the GCS score is 15. So I cannot see any bleeds, infection, rashes and bruises. So Heather, can you please tell me, is there anywhere Samantha have bleeds, bruises, infection or rashes that I should be aware of?
No, she doesn't have any.
Okay, thank you. So Samantha, can you please tell me, is Samantha has completed all her childhood vaccination or anything is pending?
No, she has done all the childhood vaccination as per age.
Okay, that's great. And one more question, if Samantha have any other past medical history?
No, apart from this, she has not been admitted for any other admissions.
Okay, thank you for answering for those questions. Samantha, do you have any concerns?
No.
Okay, I have done with my A to E assessment. So I'll remove my PPE, wash hands, document, and I'll come back. Is that all right?
Okay.
Okay, so I'll remove my PPE. I'll discard the chemical waste. I'll wash my hands. Okay, Samantha. So as I mentioned earlier, you are in pain, right? So I am here with 4 faces. Can you please choose one face for me? If this blue is with no pain, green for mild pain, yellow for moderate pain, and this orange for severe pain. So which color would you prefer?
It's orange.
Orange. Okay, so the orange is for number 7 to 10. So now will you able to choose one number from 7 to 10? If 7 is mild pain, 8 is the pain which you can tolerate, and the 9 is you want something medication to relieve your pain. The 10 is severe pain. Which one will you choose?
9.
9. Okay, I'm really sorry to hear that. So I'll go through your prescription and I'll get if any pain medications are prescribed. Is that all right?
Yes.
Okay. So Samantha and Heather, I am back. So I have documented all the observations which I have got, and I have got a Pew score of 2. In that, I'll reassess after 60 minutes. Does that make sense?
Okay.
Okay, so now the GCS score which I have got is 15, that's normal. Okay, so Samantha and Heather, would you mind if I ask you some questions? Okay, Heather, did you notice any physical abnormalities or any mobility changes in Samantha other than this fall?
No, she's active and mobile.
Okay, so can you please tell me how she is at home? How her relationship with her father and siblings?
She has good relationship with her father and siblings, and she keeps on playing with them.
Okay, so did she play with friends at school or she's try to be alone?
She is very active with her friends.
Okay, thank you for answering those questions. So Samantha, are you like to go into school?
Yes, I like going to school.
Okay, so you like to study?
Yes, all the time.
Your favorite subject is maths, right?
Yes.
So other than that, what game will you prefer to play at school?
We play chess.
Chess. Okay, that's great. So now, Samantha and Heather, I am going to read the information in your document so that I can confirm the informations with you, and you feel free to add if I miss any information. Name Samantha Ru, date of birth 1/1/2008, address 18 Park Road, Tooting, postcode SW17980, GP Dr. Palmer, Garak Medical Center, Tooting. The presenting complaint is Samantha complains of right hip pain following a fall at her friend's house. Is that right?
Yes.
And her right leg looks a little bruised and with noticeable swelling and redness around her right thigh.
Yes.
She took paracetamol, but she is still on pain. Is that right?
Mhm.
Yes. About her medical history, as you mentioned earlier, she has had completed all her childhood vaccinations and she is physically healthy and mobile.
Yes.
Okay, so about her social history, she lives together with you are living together in one house. Her father Anthony, mother you Heather, sibling Megan and Michael. Is that right, Samantha?
Yes.
Yes, and she attends Kings Road Middle School. Is that right?
Yes.
Okay, so Heather, can you tell me, is she taking any regular medications at home?
No.
Okay, so there in the document also it's mentioned no medications she is taking regularly, and as you mentioned earlier, she is allergic to lactose and pollen, and she will get rashes when she is taking these two substances. Is that right?
Yes.
Okay, do you have any information would you need to add more?
No, that's it.
Okay, that's it. Thank you for that. Also, do you have any concerns or doubts?
No.
Okay, so are you happy for me to leave?
Yes.
Okay, so here is the call buzzer. You can press the buzzer at any time if you need anything so that I can come and assist it. Is that all right?
Okay.
So I close my station by doing hand washing. Palm to palm, back of the hands, interlace, interlock, rotation motion of thumb, fingertips, air dry for 30 seconds.